We are going to start our presentation today by introducing you to our patient, Mr. Peter Parker. Mr. Parker is a 38-year-old Caucasian male. He is widowed and has 2 children under the age of 12. For a living, Mr. Parker is a long-haul interstate truck driver, which keeps him immobile and sitting for great lengths of time. He lives in the low socio-economic area of the Greater Denver and admits to not maintaining a healthy lifestyle.
On admission, Mr. Parker presents with the following symptoms: unmanageable pain around the back, sides, and groin, indicating renal colic. Symptoms of his recurring UTI are increased, there being hematuria, bloody urine, dysuria, pain on urination, and increased need to urinate, but in smaller amounts. He also reported being nauseated, having diarrhea, and needing to vomit. The medical team in the ED suspect that he has kidney stones. Therefore, initial assessments revolve around this. After we have collected Mr. Parker's vital signs, which for now are stable, despite having tachycardia due to his associated stress levels and pain. First priority for Mr. Parker is pain management and dealing with associated symptoms such as nausea and diarrhea. Second priority would be to observe signs and symptoms of UTIs because kidney stones increase the likelihood of developing a UTI. If left untreated, it can develop into septic blood. We would also prioritize investigating if Mr. Parker has an obstruction. We would do this by asking how frequently he urinates, if blood is present, or if he has oliguria or anuria. On first examination of urine, it would need to be strained for stones or gravel. After making Peter comfortable with pain medication and fluids, we will commence a health history, focusing on factors that predispose Peter to renal calculi or that may cause the current presenting problems. From the information gathered in the health history, we have found that Peter has had many predisposing and precipitating factors for the formation of renal calculi. These are as follows. Peter perceives his health status as average. He shows no concern for his current health issues as he has never had any serious health implications. He blames his obesity and diet on his job, which consequently causes him to have a BMI of 40. He has a lack of motivation to change as he doesn't see his lifestyle as unhealthy because he's just like every other trucker. Peter has had no standout current health issues, yet he is obese, has low physical fitness, is depressed and has poor nutritional status. He has had no known allergies, is not on any prescribed medications. However, 4 hours ago, he did self-administer paracetamol, with nil effect. In the past, Peter has suffered with repeated UTI, leading to some incontinence. His family history includes kidney stones, obesity, type 2 diabetes, high blood pressure, hypertension, and depression. All these factors leave Peter predisposed to kidney stones and associated health problems. The psychosocial element in Peter's life have greatly impacted his lifestyle, attitude to health, and have impacted his future ability to be adherent to lifestyle changes. The factor most relating to the deterioration of his renal health are as follows. An unbalanced diet, mainly eating takeaway on the road, foods high in calcium, purine, and sodium, episodes of dehydration whilst truck driving. He rarely drinks water, but high sodium drinks like coffee, flavoured milk, and Gatorade. His activity is low due to long shifts as a truck driver. His sleep is unpatterned due to shift work and is disturbed by incontinence, stress, and depression. Low morale due to little spare time to spend with kids, have hobbies, and participate in activities. He has a good relationship with his children and parents, but regularly feels lonely due to the loss of his wife. He believes that he has to work hard to make a living to support his family, making him reluctant to ask for help, causing more stress. He hasn't pursued further education than Year 10.
Hi, I'm Chen Jicui. I'm going to talk about the pathophysiologicals of kidney stone, since urinary concentration is the main factors that lead to kidney stone formation, rather than the amount of crystallizing solute in the urine. Therefore, the reducing of urinary volume can be the main reason cause all stones formation. What's more, inadequate water intakes or excessive loss of liquids can cause low urinary volume. Peter mainly eats takeaway food and rarely drinks water. His obesity and sweating. His dietary patterns will result him in inadequate water intake. Sweatings make him lose excessive liquid, so all his current situation stimulates stones forming. The main pathophysiological factors for calcium stone is hypercalciuria. Hypercalciuria increase absorption in gut, which will be aggravated by excessive sodium injection. A high rate of kidney stone formation is closely associated with high dietary salt, which will increase bone resorption and sodium-induced physiological renal calcium leak. Peter's dietary habits directly leads to the excessive sodium injection, which will promote the formation of his kidney stone. Hypercalciuria is also associated with protein load and systemic acidosis. Excessive protein load will cause protein-induced bone loss, renal leak, and leading to a low body pH level. Peter's BMI is 40, which was far higher than the normal range, and the normal range for adults is 19 to 25. He is also lack of exercise, so his excessive obesity tends to make his body environment become more acidic, which will increase the stone risk. Neither hyperuricosurias, acidic uric pH, or both can cause uric acid stone. This problem makes uric become polysoluble uric acid. Obese patients with high triglycerides will have more chance to have hyperuricemia than normal patients. Studies have proved the increasing importance of insulin resistance in the pathogenesis of uric acid stone. Therefore, high BMIs, glucose intolerance, and type 2 diabetes are common in uric acid stone formers. Peter is obesity and he is type 2 diabetes, so he is more vulnerable to the threat of uric tract stone. Struvite stones are mainly caused by urinary tract infections or caused by kidney infection. Peter has a health history of urinary tract infection. What's worse, his symptoms of this disease are increased and getting worse, so he is at high risk of getting a struvite stone. I will list and explain the difference between normal and dysfunctional state of kidney stone. Patients will feel a sharp pain in the areas of the kidneys or in the lower abdomen and want to vomit when they have kidney stone. Since the stones may block the ureteral tract, patients may need to urinate frequently and feel harder to drain urine. Red, pink, or brown urine may be found, which indicate that blood is present in urine. I will introduce some potential complications of kidney stone. First of all, since the stones are too large to pass through the ureters, the obstruction of ureters may happen. The second point is extremely sharp pains may be caused when the ureters try to squeeze the stone towards the bladder. Thin stone keep rubbing the surface of ureters and kidneys. Permanent kidney damage can be caused. Kidney stone can also increase the risk of urinary and kidney infection. Last but not least, germs will spread into the bloodstream when urinary and kidney infection are caused by the kidney stone.
Hi, now I'm going to talk about the pharmacological interventions. I have worked out 4 pharmacological interventions. They are ALF reductase inhibitors, pain relievers, anti-emetic medication, and urinary anti-infective drugs. They all play a very important role in treating the kidney stones. The major problem of the patient is kidney stone, so nurses should give him medications that works on passing the stone. Alpha reductase inhibitors can help this. The most common one of this medication is tamsulosin. Others like nifedipine and terazosin also works well. They can help urethral muscle to relax and pass the stone more easily. The contraindication is that it can be only used in males and not allowed for females and children. People cannot take it if they are allergic to the medication. There are also many side effects of tamsulosin. Firstly, it can cause runny nose, diarrhea, headache, and cough, but most of these symptoms may disappear after a few days. Secondly, it can affect male sexual function, which will lead to retrograde ejaculation. Thirdly, allergic reactions are very common, and patients should pay attention to that. For safety management of the drug, nurses should make sure patients do not take it with the drugs that have similar functions, and also check patients' age to make sure they are over 18. And furthermore, if patient has kidney disease, nurses should check with doctors to whether they can use it. Kidney stone always come with severe pain, so pain relievers is very important. For example, non-steroidal anti-inflammatory drugs can have effective treatment on pain and the patient can get them without prescription. This type of drugs includes ibuprofen and aspirin. It's better to take them with food, otherwise they may lead to stomach upset, nausea, or vomiting. Using this medication for a long time, it may cause renal problems and stomach ulcer. Sometimes heart attacks also occur. There are contraindications of pain relievers. For example, people with renal problems such as renal calculi cannot take these drugs for a long time. It can worsen their current condition, so we do not suggest Parker to take this. He has to see the doctor and cure them. For safety, we should use this type of medication at the lowest dose to see whether it works well, and do not use them for a long time. If patients have kidney or stomach problems, may feel uncomfortable when using them. As patient is experiencing nausea and vomiting, anti-emetic medication should be used. This type of medication can help patients control the feeling of nausea and stop vomiting. The commonly used anti-nausea drug is prochlorperazine. It should be prescribed by physicians. The contraindications is pseudoestradiol. Children under 2 years old cannot take it. Additionally, it's safety for people who are at the early stage of pregnancy, but in the later stage it may cause neurological problems on infants. The common side effects are constipation, drowsiness, dry mouth, and blurred vision. When nurses administer oral medications, they should give 2 mg first and 10 mg after 2 hours. If patients still need it, they should give them 5 to 10 mg 3 times a day. If on intravenous or intramuscular therapy, it should be used as 12.5 every 8 hours and given over 2 minutes. This medication will make patients feel sleepy and increase the effect of alcohol, so people should take a rest and avoid driving after taking this medication. Mr. Parker also has urinary tract infection, which is known as UTI. We should give him urinary tract anti-infective drugs. They are used to prevent or treat UTI. The most common UTI drugs are nalidic acid, nitrofurantoin, and methenamine, and this type of drugs should also be given on the physician's prescription, because methenamine may have side effects on patients with liver disease, so we can give him with nalidic acid. There are also some contraindications. Firstly, patients with diabetes have to pay attention to the drug use because it may influence the result of urinary blood glucose test. Secondly, it's also found that this drug can interrupt the bone growth, so the pregnant are not suggested to use it. What's more, people may bleed when they take it with anticoagulant at the same time. There are few side effects after patients take this drug, and symptoms will disappear after they get used to the drug. Symptoms could be drowsiness, dizziness, vomiting, nausea, and headache, and we do not have to pay much attention on it unless it's getting worse. When stopping anti-infective drugs, nurses should make sure symptoms has completely disappeared. If the clinical response is slow, nurses should check the original diagnosis.
Now that we've completed the health history, we can start our nursing interventions. Our first intervention will be pain management. Kidney stone pain can be quite severe and debilitating. When pain is managed ineffectively, it greatly influences patients' recovery, consequently leading to increased readmissions, prolonged length of hospital stays, and poor clinical outcomes. To manage Peter's pain, we would conduct a thorough pain assessment, an investigation for the cause of pain, provide medication, and assist Peter in finding any factors that make him more comfortable. Initially, a thorough pain assessment should be undertaken to determine the type of pain, intensity, location, duration, and any radiation of pain. The assessment can be undertaken by using the algorithm PQRST. P stands for provokes, what causes the pain. Q stands for quality, what does the pain feel like. R stands for radiating, where is the pain, does it move around. S stands for severity, rate your pain from 0 to 10. T stands for time, when did the pain start. A thorough and accurate pain assessment can help identify the cause of pain and appropriate pain relieving interventions. Depending where the pain is, it can help investigate what kind of stones the patient may have. Peter's presenting problem was pain around his back, side, and groin. This is known as renal colic, an extreme sudden onset of pain due to urinary obstruction. It is often accompanied with nausea, vomiting, and restlessness. However, investigation tests would need to be undertaken to be sure that this is in fact renal colic pain. For example, a urine analysis and a fluid balance chart. After investigating the cause of pain, a correct and individual care plan can be implemented for Peter in order to have a fast recovery. Once the pain assessment is complete, pain medication may be given. Initially, Peter would be provided with opioid analgesics with NSAIDs like ibuprofen and aspirin to control his pain. These would be taken along with antiemetic medications to control his feelings of nausea and prevent vomiting. These medications would assist Peter in managing his pain and nausea, making him more comfortable and less restless. He would be informed to report any sudden increases in pain immediately due to the possibility of obstruction. Peter would be encouraged and assisted to lie in comfortable positions and ambulate in an attempt to feel more comfort. He may also be provided with a heat pack on his lower back or a back rub in order to comfort and relax his muscles. Attempting to create a calm, relaxing environment may also be beneficial, as well as encouraging deep breathing, guided meditation, and other diversion activities. Finding any relieving factors for Peter's pain would be beneficial in the overall pain management. Encouraging him to ambulate also facilitates spontaneous passage.
Once Peter's pain has been dealt with and he is comfortable, our next intervention is to increase his water intake. By doing this, an increased hydrostatic pressure in the kidneys will facilitate the passive expulsion of kidney stones. This is the first line of action, as it is desirable for kidney stones to pass spontaneously. However, due to variations in size, shape, and location, this is not always possible, and invasive medical interventions are needed. The decisions for such interventions are made by the doctors and are as follows: extracorporeal shockwave lithotripsy, percutaneous nephrolithotomy, endoscope removal, and surgery through the back to the site of calculi obstruction. All these interventions are out of the nurse's scope of practice, but it is good to be aware of alternatives. By any means, it is crucial to remove kidney stones to prevent infection, blood sepsis, discomfort, hemorrhages, and total obstruction leading to potential bladder retention. Secondly, it would be important to collect any eliminated stones and send them to the lab for composition analysis. The nurse would collect the stone by collecting the urine and straining it through a gauze. It is crucial to know the composition of the kidney stones, as it identifies the cause of their formation, how to prevent them, and guides the medical team on how to treat them. Thirdly, taking blood samples and urine samples for screening in a lab would be an intervention done regularly. Once in the lab, they will be checking for imbalances in electrolytes, amounts of nitrogen in the blood, and many other elements that could signify manifestations of renal calculi exacerbations. Identifying any abnormalities will assist in indicating presence and degree of kidney dysfunction. It will also identify if a UTI is present, which would be adding pain and discomfort to Mr. Barker.
Continuing on with potential complications, Peter is at risk of having deficient fluid volume. Due to his nausea, vomiting, and sweating, he is at risk of developing fluid imbalance, making him more dehydrated, which would consequently make the kidney stones worse. Firstly, encouraging Peter to drink plenty of water would be very beneficial. Drinking water increases the hydrostatic pressure within the urinary tract, which promotes the passage of the stone. He admits that he rarely drinks water, meaning he would already be dehydrated. His vomiting and sweating would also add to this. Thus, water intake is crucial. If he is unable to keep the fluids down or can't drink that much water, IV fluids would be more beneficial to maintain his hydration and renal function. Secondly, monitoring and documenting input and output, examining characteristics of his urine, and weighing him regularly would be important. This would assist in examining kidney function as well as any water retention. Characteristics of urine may indicate infection, requiring further investigation. Weighing Peter regularly may indicate water retention if he has rapid weight gain. After documenting all these factors, it would be easy to note any variations of Peter's voiding pattern. Thirdly, we would monitor his vital signs, capillary refill, skin turgor, and mucous membranes. These assessments will indicate how hydrated Peter is. Consequently, he may have a decreased glomerular filtration rate due to his kidney dysfunction that will stimulate renin production, increasing his blood pressure. His temperature would also be closely monitored to detect early signs of infection. Patient education is an important intervention as it enables patients to have continuity of care when they return home, leading to better self-management and less complications. We'll be educating Peter on the underlying pathophysiology of his prognosis, specific dietary and lifestyle changes needed, the signs and symptoms for kidney stones, and intended medications and treatment regimes. It is important to remember that education is a continuous teaching and learning process. When educating Peter, we would use a vast range of techniques such as continuous repetition, patient recall information, visual aids, and community-based learning. We would start with education on relevant renal pathophysiology. We would limit medical jargon and keep it simple. The degree to which Peter understands the importance of modifying his current dietary habits depends significantly on his understanding of which foods put him at risk. He needs to drink 3 to 4 litres of water a day, or enough to produce at least 2 litres of urine. This ensures avoidance of supersaturation of calculi-forming solids. He needs to limit intake of excessive vitamins and minerals. This is because excessive amounts contribute to stone-forming supersaturations. A maximum of 60 grams of animal-derived protein, because this decreases calcium and uric acid excretion. A maximum of 2 to 4 grams of sodium a day, as sodium competes with calcium for reabsorption at the kidneys, and if left in the urine, calcium combined with oxalate or phosphate and cause stones. If Peter is diagnosed with hypercalciuria, we would educate him on the need to limit his calcium intake. Depending on what type of stone Peter has, there will be more specific changes in his diet. For calcium phosphate stones, a reduction in sodium, animal protein, and foods high in oxalate would be recommended. We reduce sodium, particularly table salts, as it increases renal excretion of calcium. A reduction in protein is recommended as it increases calcium and urea in the urine. For calcium oxalate stones, we recommend a reduction in sodium and oxalate-rich foods. This prevents an overconcentration of oxalate in the urine, and hence decreases the likelihood of oxalate binding with calcium to form stones. For uric stones, we recommend a limit in purine-rich foods, meat, organs, seafood, and some veggies, because it breaks down into uric acid in the urine. For cystine stones, we recommend a reduction in animal proteins, because cystine is made from a protein found in animal products. For struvite stones, an infection-caused stone, we recommend to maintain fluids as it keeps the urine flowing and dilute. Mobility is recommended, and the rationale for this is that it increases renal drainage and helps calcium metabolize. Keeping in mind to avoid activities and temperatures that will induce excessive sweating, as this leads to dehydration. The early signs and symptoms of the formation of kidney stones are fever, chills, flank pain, and hematuria. By having this knowledge, Peter will be able to identify when his renal health is deteriorating, and thus he could seek medical interventions before the stones cause further damage. We would educate him about the therapeutic effect of prescribed medications to ensure adherence. We would inform and plan for regular checkups to ensure healthy kidney functions and prevention of rehospitalizations. The more involved in understanding Peter is with his care plan, the more likely he is to be adherent and continue it for the long term.
Safety and quality health service and standard is designed to improve health services in Australia. It requires healthcare system to develop a safety environment for safe patients and focus on creating a consumer-centered healthcare system to improve the quality of the service. In this case, Mr. Parker should be sent to hospital and get standard tests like abdominal X-rays and CT scan, so healthcare professionals can know what effective actions they should take. Also, according to the NSQHS, medication safety is very important, so we have to give medication according to medication chart and doctor's advice, and change medication if some uncontrolled side effects happen.